Welcome to a special edition of Public Health on Call. I'm Stephanie Desmond. Today, we are going to talk with Joanna Cohen, who is the current director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health, and John Samet, the founding director of the Institute and former chair of the Department of Epidemiology at Johns Hopkins School of Public Health, and the former dean of the Colorado School of Public Health. Thanks for joining me. Our topic today is the 25th anniversary of the Institute, and I wanted to talk to you a little bit about sort of how we got here and what you all are doing in this goal of winning the global tobacco war. So I'd like to start with you, John. How did the Institute come to be, and what was the goal?
Well, it came to be a long time ago, obviously 25 years, in fact. I came to Johns Hopkins in 1994 to be the chair of the Department of Epidemiology, having worked on the health consequences of tobacco and its control for a long time at that point. When I arrived, Johns Hopkins really did not have a focal point for work on tobacco. I began a program in China, working with colleagues in China at the Chinese Academy of Preventive Medicine. And that became the starting point. We, as an institution, looked at how we could do global tobacco control, how we would have an institutional focus for it, and really beginning with that work in China and then moving on to other countries and expanding the base of funding, the idea for the Institute was born. By 1998, we had enough in progress that seemed like we should have an institute.
And you are an international focused organization, and I'm curious why you chose that focus.
Well, the tobacco problem is a pandemic. It's global. And I think at the time in the 90s, we were really beginning to see progress in the United States, but concern elsewhere. And the tobacco industry had cynically turned to other nations where there were large populations of smokers to sell its products. And clearly there was a need for working with colleagues in other countries, moving some of the lessons learned in the United States and other higher income countries to places that face really the peril of a rising use of tobacco with the aggressive and well-honed tactics of the industry.
Mm-hmm. I was curious about sort of the industry and their role in all of this. I mean, were they mostly focused, Joanna, on other countries because we weren't smoking as much here in the United States?
Well, they're always looking to the future of how to keep their profits as high as possible. And as John said, I mean, they saw the writing on the wall, although it's still taken decades, and we still have millions of people who smoke in this country, and we're still going to be suffering a lot of tobacco-caused death in this country. But great news that smoking rates are going down here, and especially among kids, the lowest ever rates of smoking. But they saw huge populations, as John said, and opportunities to really push their products, and countries that might not have had the as much of an ability to implement the strong policies that are needed to keep them at bay.
Mm-hmm. What are some of the work that you all do currently?
I'm so excited about the work that we're doing now. And maybe I'll just say, John is a world-renowned sort of lung specialist, epidemiologist, and he focused a lot on sort of the health effects of active smoking, passive smoking, and the importance of smoke-free public places. My work has been more focused on policy, and we're looking at more of the marketing tactics of the tobacco companies, how they package their products, how we can counteract that with very effective health warning labels, plain and standardized packaging of cigarettes and other tobacco products. We're also looking at litter of tobacco products. I mean, I think we've all had the experience of walking down the street and seeing an old package pack of cigarettes on the ground. Well, in some of these countries, India, for example, not only do they have cigarettes, but they have smokeless tobacco in sort of non-biodegradable plastic packs. And those are all over the ground. So has a huge environmental impact. But what we're also seeing is that it's a form of post-use marketing because you still see the brand name and the packaging on the ground. So those are, just a smattering of a couple things that we're working on.
Mm-hmm. So I'm curious. We were talking before we pushed the button to record. And John, we were talking about sort of what it was like back then, that you could smoke on a plane. And you were saying that that's only been since the late 80s, I guess, that's no longer allowed. And I'm curious if you could sort of paint a picture of what it was like in the U.S. and what it looks like today.
Well, it would be a picture of smoke to no smoke, I think, in summary. But looking at the change, of course, smoking was the norm. And if you look at about 1960, we had a majority of men smoking and probably a third of women smoking, and it was ubiquitous. When I trained in medicine, people smoked in the hospital. The so-called nursing station where people wrote in charts was smoke-filled. Some specialties made rounds with cigarettes in their hands, leaving them outside on a railing, burning away and coming back out and grabbing their cigarette. I had instructors who smoked in class. So the world was completely different. I will say, Joanna mentioned early work on smoke-free environments, secondhand smoke. It was that evidence that tipped the balance and, showing that passive smoking caused lung cancer in people who had never smoked, for example, was part of the scientific evidence that made a difference. So the landscape of tobacco control has continually shifted from one facet of the problem or several to new ones. And I think, in general, for example, of course, there's no smoking on airplanes since the early 90s and other public transport. Restaurants are smoke-free and so on. So there's one battle won. There's still some mop-up action going on, but that battle is won. But we're on to new ones. And now we have this totally different tobacco marketplace that we'll, I'm sure, get to and discuss with various electronic products, new channels to disseminate information and misinformation about these products. So there's always an ongoing need, unfortunately, in tobacco control to do things and to counter the ever-shifting strategies of this very chameleon-like industry.
Mm-hmm. And I know that there's a lot of work being done, Joanna, on tobacco control policies. So talk to me about sort of how the surveillance work you're doing and how you're sort of, reimagining the problem.
Right. So one of the things that we're working on is describing the extent of tobacco marketing at the point of sale, which is the physical location where people can buy tobacco products. And one of the issues is that not only is it the people who buy the tobacco products that see all the advertising and the beautiful products displayed, but people who come in for other things also see it, including kids. And the tobacco companies are very clever, and we have documented in multiple countries that, cigarettes are placed sort of at eye level of kids, about 3 feet high. So kids can come in, they see the marketing, they see the product, and in some stores they even have signs facing the outside. So you don't even have to go into the store to walk by and see tobacco advertising. So we've been doing studies in a number of countries that document the tobacco advertising and promotion in stores that are around schools, sort of within a certain radius of schools. And I think that's all to equip policymakers, public health professionals with evidence to help them say, look at the problem. We have to do something about this.
Mm-hmm. How receptive are governments in other countries to this sort of policies?
It depends. Every country is different, and it depends on the time and the context. But there have been amazing advances all around the world, and I think John said that we had learned a lot in this country and wanted to share that. But in the past couple of years, a few colleagues and I wrote a paper of some of the innovations that have happened, not just in other countries, but in low and middle income countries that have gone way beyond us. So, for example, health warning labels on cigarette packs. We currently have, you can't see the health warning label, right? It's on the side, by the way, in text. But you have other countries, including some low and middle income countries, that have big picture warnings. That catch your attention, that helps you remember. They give you an emotional response. This is the first country that implemented plain and standardized packaging. This is Australia. So big picture on the front, big, picture warning on the back. There's yellow on the side. So a lot of countries have taken, what we've learned and have leapfrogged forward. There are countries that you have what we call tobacco display bans. So you can walk into a store, but you won't see any tobacco products. They'll be under the counter or behind closed shelves. So you don't have that constant pull of the product sort of calling your name and saying, buy me. So there have been a lot of countries, including low and middle income countries, that have made a lot of advances.
Mm-hmm. I know your early work was in China. Can you talk about sort of where they are and where they've come from?
I'll talk, and then I think ask Joanna to chime in. I think the remarkable thing about China is that it's the government actually that makes and sells the cigarettes primarily through its state monopoly, China National Tobacco. So the situation is somewhat unique. There were prior national monopolies. Japan Tobacco, for example, was a national monopoly. I think Vietnam still has one. And in China, when I first started working there, probably 60, 70% of men smoked. Fortunately, only a small percentage of women smoked, which seems to still be true, although I've always worried that this large number of young Chinese women would be an attractive target. They certainly are for the industry. Smoking has dropped somewhat, but it's still a huge problem in China. And the government still generates substantial revenues from tobacco in spite of the changes in its economy. And several of the provinces are quite dependent on tobacco tax revenues for their operations. So China has a long way to go. I think there's an understanding that, in fact, the government is generating illness. But the problem, I think, remains one for them to solve. But perhaps Joanna has more recent understanding.
It's still a huge problem, but there have been some successes. So Beijing, for example, is 100% smoke-free. There have been some other big cities and work in some of the provinces to go 100% smoke-free. So, it's much more challenging because of the issues that John has mentioned. But there's progress. There are a lot of people who care and who are working on this just as hard as people in this country have been working on the issue.
I will say anecdotally, I remember sitting in a prior airport in Beijing in a restaurant in the non-smoking area, if you will, surrounded by cigarette smokers. And we asked the waitress about this, and she came and just shrugged her shoulders. But when the new airport opened, there was actual enforcement. That was probably 20 or more years ago now, but there is adherence now to non-smoking where smoking is not allowed.
It's interesting that you have such an uncooperative government, for example, in China, because they profit off of it. Is that one of the obstacles that you face when you're looking at other countries? That the government can profit off it, so they're not as inclined.
It's not just that. I mean, I have to show that. So this is our cigarette pack in this country.
Right.
There's no health warning label. There's no picture on it. We're still waiting. We've been promised since 2009 with the Tobacco Act that there'll be picture warnings on our packs. We're waiting. So, of course, there are those direct financial factors, but there are a lot of, there's the tobacco industry lobbying, lots of money poured into, try and keep their sales as high as possible.
Yeah, I mean, the tobacco industry still wields political influence, perhaps not nearly so blatant as before, but it's still there.
So let's talk about e-cigarettes. Now, they're not tobacco, but they're definitely addictive. And I'm wondering if you could talk to me about sort of the evolution of that and why our kids are now vaping. What are the ways that you can, fight that?
Well, so there's actually a long history of the tobacco industry turning to electronic products. There was an early product, Premier, probably 30 plus years ago, for example, that was test marketed that did not work out. This current generation dates to a patent in China in 2003. And I think what's remarkable is how quickly these devices have spread, the technology has advanced, and essentially the e-cigarettes are able to give a aerosol that's exactly the right size to go deep into the lung. And what, of course, they deliver is nicotine, and in ways that are tolerated by adding flavorings, because nicotine itself is irritating. Just one other comment is there's another generation of products, the so-called heat-not-burn products, like IQOS, IQOS, that heat tobacco, more or less, and drive off a vapor that is then inhaled without combustion and not as an aerosol, but as a vapor.
And you've done research into vaping.
Yeah, so the Institute for Global Tobacco Control does a lot of global work, but we also do domestic work as well. And one of the studies I'm very proud of is called the Vapor Study, vaping and e-cigarette use research, study, vapor. And it's a longitudinal cohort of adults in this country who frequently use e-cigarettes. And we've been able to collect very detailed data about their devices and the liquids that people are using. And as John said, I mean, there's so much heterogeneity in the devices and even the liquids, all the flavors. So it's challenging to regulate, but we're seeing changes over time. Just as the market evolves, of course, the types of devices and how that people are using them is changing as well.
For the better?
No. Well, I mean, this is the thing. It could be for the better. I mean, we all want to help people who smoke quit cigarettes, right? And potentially e-cigarettes could do that. But the challenge is our regulatory system. And when you have these products available everywhere, advertised through social media, which I think you were hinting at previously, with the fun flavors that are attractive to kids, that's not a product that's geared towards helping people quit. So that's not the message that we're giving. And we have no guidance for, like, if someone wanted to quit, which of all these thousands of devices and liquids should someone use, right? So we don't have that evidence yet of what physicians can recommend to their patients who want to quit. So far, not for the good, because we've seen a whole epidemic of youth starting to use these products, getting addicted to nicotine, who would not have used nicotine without these, because we're at historical levels of cigarette use. It's continued to go down. And unfortunately, this has change that curve. But, we hope with the FDA in this country can really work to get the right regulatory framework to really use these products for good.
Mm-hmm. I know you've used tax increases I know that's been done in the United States to hopefully induce people to quit smoking. Is that a tactic that you also use internationally?
Oh, yes. I mean, in fact, better in many countries than we do here. I mean, we know very well that as the price rises, youth are less likely to start smoking. And of course, at some price points, it becomes prohibitive to smoke. So a pack of cigarettes in Australia, probably $20+ Australian. Now in Colorado, you can buy a package of cigarettes for a little over $5. So there's quite a contrast. UK also very expensive. So we could do a lot with basically tax as the vehicle to raise prices, and we haven't done enough. Prices have gone up, but we have a lot that we could do in the United States. And of course, it varies state by state. In New York, Joanna, you probably know how much is a pack of cigarettes, $12 perhaps, $14?
It could be. I haven't bought a pack there recently, but yes.
And I know that you also did some work in Mexico. I'm wondering if you could talk to me about those efforts.
Well, we're doing a lot of work in Mexico. Actually, maybe you want to start. You've been involved in their summer course for years.
Sure.
Maybe start with your work in Mexico.
Well, so the work in Mexico dates back to the earlier times of the Institute, and we had extensive collaborations with the National Institute for Public Health, in part because with the director of one of the centers, and then later the director, Mauricio Hernandez, we started a summer course in epidemiology, and then epidemiology in public health. And then we had a grant from the National Institutes of Health for global tobacco control that supported the founding of a Center for Tobacco Control at the National Institute for Public Health that continues, and the Institute continues to collaborate in Mexico.
Right. And we've done a lot of work in a range of areas, including illicit trade. And because one of the things the tobacco industry does to counteract proposals to increase taxes is say, well, there's going to be a whole black market and all this illicit trade of products, and there's this much illicit trade. And when you have independent studies looking at how much illicit trade there is, it's much smaller. So we've collaborated on studies related to illicit trade. We've worked on studies related to flavors of cigarettes, how people perceive them. This is actually, I have to bring my packs, but this is a pack from Mexico, and it has 3 different flavor capsules. So you can choose whenever you want to squeeze whichever one you want, or all 3 in whichever order, and get different flavors. These are very popular in many countries around the world, particularly in Latin America, but we're seeing them pop up around the world. And so, again, the tobacco industry is continuing to prey on people, trying to do whatever they can to put out new products, keep people interested. And kids see this as, we have a quote from one of my colleagues, Jenny Brown. She did some focus groups actually in the Philippines. And some of the kids said, yeah, these flavor capsules, it's like candy. You just have to press on it. You get your candy. It's very sad, but effective, unfortunately.
Mm-hmm. I'm wondering, as we begin to wrap this up, where do you guys see the future of tobacco control headed? John?
Well, I've made wrong predictions a bunch of times. And, the world was simple. We had basically one product. There were 20 in a pack. People smoked about a pack a day, and they were smoking less. And things seemed to be progressing nicely downward. And suddenly we have this incredibly challenging new marketplace with really the dangers of having new generations of young people hooked on nicotine. We have the global market, which is really very complex right now. And there are places where smoking is very low. I'm doing a lot of work on environmental issues in sub-Saharan Africa. Tobacco use is quite uncommon there, and we need to keep it that way in most countries. So the challenges ahead are quite varied, depending on where the epidemic is, what the country is, and what the needs are. And, frankly, what the disease patterns are that have resulted. So I think we need sort of a full armamentarium that we can use some things in sub-Saharan Africa, and what you might use in the United States is quite different. And we need to continue to innovate in our efforts to deal with these complexities.
I'd like to ask actually real quick about sub-Saharan Africa. Is there a concern that tobacco companies are headed there?
They have been, and there has been that concern. I know that there's not necessarily been great success yet, and which is fortunate. There are efforts to control tobacco. Some of it started with the Bloomberg and Gates initiative. So there's building tobacco control capacity is going on in sub-Saharan Africa, in particular. Northern Africa, smoking rates are high, particularly among men. But certainly would not like to see tobacco use added to the list of many threats to health in sub-Saharan Africa.
Mm-hmm. And Joanna, where do you see the future?
Well, I have to be optimistic.
Good.
I've been doing this for over 30 years. You much longer. But we're not here to continue. We want to end this as soon as possible. And I think we have our sights on the tobacco endgame. We're talking about it in this country, and people around the world are talking about how we can end the tobacco epidemic as fast as we can. And how do we innovate to do that? We see some countries like New Zealand being very intentional about how they're moving forward in this area. And there's no reason why we can't be doing that around the world. So I'm really excited about the energy that's being brought to bringing an end to the tobacco epidemic once and for all.
How likely is that?
We'll get there.
We will. I think the question is when. And you can look, just following up on their countries, Panama comes to mind, where I have good friends who have worked very hard on tobacco control, and tobacco prevalence below 5%. And that's true now in a few other countries. So we have made progress, but you have to realize that the, quote, tobacco industry is a relatively small number of very large corporations. And with, again, other bits and pieces of local companies. But these are companies that don't plan to go out of business. So that's really the threat to the world.
Joanna Cohen, John Samet, thanks so much for joining me.
Sure. Delighted.